The component of the cast partial denture that we'll be discussing today is major connectors. A major connector is defined as a component that connects components from one side of the arch to those of the other. It provides unification of components, distributes the applied forces, minimizes torque on the teeth, and provides cross-arch stabilization. To perform these functions, a major connector should be rigid. It should not impinge on the underlying soft tissues. The border should be parallel to the marginal gingiva and cross the marginal gingiva at right angles. It provides vertical support, provides indirect retention where required, and should not allow food lodgement. Today we are going to look in detail at the maxillary major connectors. The first major connector we are talking about today is the palatal bar. A palatal bar is a thin section of metal that is less than 8 mm and half oval in cross section. This is indicated in short span tooth supported RPDs. A major disadvantage of the palatal bar is that it lacks rigidity because of the thin width of the palatal bar. The next major connector is a palatal strap. The palatal strap is a wider thin section of metal which is greater than 8 mm. It provides adequate rigidity with less bulk as compared to the palatal bar. The disadvantage of a palatal strap is that it may interfere with speech or lead to papillary hyperplasia because of the greater coverage. The third major connector that we are looking at is a horseshoe shaped major connector. It's a thin band of metal that runs along the lingual surface of the teeth and extends about 6 to 8 mm onto the palate. The disadvantage of this major connector is that it flexes because of the lack of rigidity with the major connector. So it is indicated in short span class 1 and class 2 situations. The fourth major connector that we are looking at is an antero-posterior palatal bar. These are two palatal bars with the posterior bar being similar to a palatal bar with a half oval cross section. These are again indicated in short span tooth supported RPDs, and a disadvantage of this is that it interferes with speech. The antero-posterior palatal strap. Each strap is 8 mm in width and is connected by these longitudinal metal structures that lie at the junction of the horizontal and vertical slopes of the palate. These are indicated in Kennedy's class 1, class 2, class 4, class 2 mod 1 cases, or in cases that have an inoperable tori. One disadvantage with the palatal antero-posterior palatal strap is that it may interfere with speech. The last maxillary major connector is a full coverage palatal major connector. It follows the contours of the palate, thereby does not interfere in speech and has good rigidity in thin sections. This is indicated in class 1 and class 2 situations, also in situations where some or all anterior teeth remain, so that it provides maximum rigidity to a class 1, class 2 situation.